My name is Lisa Breutman, and I'm Deputy Division Director for NHANES. Today's presentation will begin with remarks from Dr. Rennie Paulos, Acting NHANES Division Director, and Dr. Brian Moyer, Director of NCHS, followed by presentations by Dr. Cynthia Ogden, Analysis Branch Chief, and David Woodwell, Planning Branch Chief. We'll have a brief question and answer session following Cynthia's presentation, followed by a longer question and answer session following David's presentation, during which questions may be answered by any of the presenters. As a reminder, the audience is currently in a listen-only mode. Questions or comments may be entered through the chat box at any time throughout the presentations, and we will address them as time permits during the Q&A sessions. And now I'm pleased to introduce today's first speaker, Dr. Rennie Paulos.
Thank you, Lisa. Welcome, everyone, and thank you for joining us today. As Lisa mentioned, my name is Rennie Paulos, and I'm the Acting Director of the NHANES program. During our webinar back in June of last year, NHANES was still out of the field, and we had just released data from our 2019 to March 2020 pre-pandemic data. Thankfully, a lot has changed since then. We've continued to release many more data files. We've overcome many challenges to get NHANES back in the field, and we've overcome additional challenges since being back in the field. We've worked with many of you during 2020 as well as 2021 to scale back survey content, to minimize the time spent in close contact, and to minimize the risks to our participants and staff. We persevered through Delta and Omicron. We overcame supply chain issues to obtain PPEs, exam gowns, even dry ice, and much more. But one thing that has not changed is our commitment to collecting quality health data. We completed a dress rehearsal mid last year to ensure proper training of our staff and to address operational issues. And now I'm delighted to say that data collection has been completed in 7 of our 15 locations for the survey year. Our field staff are definitely happy to be working and back on NHANES, and so are we. Today's webinar is designed to support your analysis of NHANES data that have been released earlier. Whether you are a seasoned analyst or a new user, we hope you'll benefit from this demonstration of the breadth of the data on our website and how to navigate it, as well as some analytic tips. For those of you interested in partnering with us on the next phase of NHANES 2024, we're going to share a sneak peek of our plans for the redesigned survey and the timeline and process for submitting content proposals. I'm very excited for the changes we plan to implement in the next survey, including more nimble mobile exam centers, new technologies for data collection, and the inclusion of measures of social determinants of health to inform policies and programs aimed at achieving health equity. Before I end, I want to say how much I, as well as all of the NHANES staff, appreciate your continued commitment to NHANES. You continue to show the value of NHANES through your research, publications, and findings. You continue to show your support of NHANES by partnering with us, by pursuing your research interests through NHANES, by monitoring the prevalence of diseases and conditions, and the effectiveness of public health programs and policies through NHANES. Quality data begins with strong partnerships, and we definitely have and will continue to achieve more together. Before we get started, I'd like to introduce the Director of the National Center for Health Statistics, Dr. Brian Moyer, to give him an opportunity to say a few words to all of you. Brian?
All right, thank you very, very much, Rennie. So good afternoon, everyone, and welcome to today's NHANES webinar. A special thank you to our current as well as our former partners. Thank you for your support of NHANES and for making it one of NCHS's premier national health surveys. Your contributions have allowed NHANES to remain a gold standard in monitoring our nation's health and nutrition status. As many of you know, NCHS funds alone are not sufficient to support such a complex survey like NHANES. Strong federal and non-federal partnerships are necessary to support the survey and to allow NHANES to collect and deliver the data needed for surveillance, research, and for informing various national health and nutrition programs and policies. Without your support, this would not be possible. I also want to thank those joining the webinar who are researchers. Thank you for choosing to use NHANES data in your research and publications. The multi-dimensional data collection by NHANES are, the data are uniquely strong as they are connected and collected through questionnaires as well as face-to-face physical examinations. Your scientific contributions demonstrate the utility of the NHANES data and shed new light on important topics like population health, nutrition, environmental exposure, and as Rennie just mentioned, social determinants of health, including health equity. As many of you heard at our most recent Board of Scientific Counselors meeting, several innovations are underway at NCHS. Under Rennie's leadership, many innovations are planned for the new NHANES survey, which is targeted to begin data collection in 2024. I look forward to hearing how your interests and partnerships will help elevate this new survey and how we can take NHANES into exciting new territory. With your support and our dedicated staff, NHANES will continue to be recognized both nationally and globally as a benchmark for health examination surveys. So I know we have a great presentation planned for this afternoon. So let me just say a final thank you for being part of the NHANES community. I'll now turn it over to Cynthia to get the presentation started. Thank you very, very much.
So as I mentioned, when I was on mute, I'm Cynthia Ogden, and I'm the Analysis Branch Chief and Acting Associate Director for Science in the NHANES Division. And today I'm going to be presenting a very high-level overview on analyzing NHANES data. My presentation is really organized into three buckets: accessing the NHANES data, and top 10 analytic tips, and then using the pre-pandemic data files. I'm just going to end with a few slides on that. So let's start with accessing the data. I'm going to be showing you parts of the NHANES website. So if you're interested, you could go to your web browser and follow along. This is the homepage for NHANES, and you can access it through the NCHS website or a web search. I'm not going to go through everything on the website, but I do want to point out some links that are related to analyzing the data. One thing you'll note is that on the left side, there's a menu, and the same content is on the right. So to reduce the information on the slides, I've cropped that left menu for the rest of the slides. So how to access the data. So you can see I'm going to highlight things as I walk through it. Here's what you'll find if you click on survey data and documentation. You can find survey methods, including analytic guidelines that are available. Also, you can search for specific variables you're interested in. And you can go to specific data cycles. Since 1999, NHANES has been released in 2-year cycles most of the time, except for the data set that Rennie mentioned, the 2017 through March 2020 pre-pandemic data file that was because data collection stopped in March 2020 because of the pandemic. So I'm going to spend a minute on each of these three things. First on survey methods. This page contains a lot of important information, including plan and operations, and then, and very importantly, the analytic guidelines. And so I'm going to mention the analytic guidelines a few times, and I really think that they're a great source of information. You can also search for specific variables. And so this is the search variables page. And the search is based on all variables in the file since 1999. So I'm going to show that example of diabetes if we search for diabetes. If you search for diabetes, this is what will show up. And you can see that the number of variables found was 449. And you can see just the top 3 of them, obviously, at the bottom there. And these are all the same variable, but from different cycles. So you can see it's age when first told you had diabetes for 2005-6, 2007-8, and 2009-10. And it shows you the variable name, the variable description, and the data file name. You can also access, as I mentioned, data by cycle. So as an example, I'm going to walk through finding one variable in the pre-pandemic data set. Each data cycle has a page like this one that shows you the types of files, the demographic data, dietary data, exam data, lab data, questionnaire data, and limited access data, and lots of other information about using the data. Some of this also you've seen before, just like the survey methods and analytic guidelines there on the right. But I'm going to look now, because of my interest, for recumbent length in young children. And so recumbent length is a measured variable, so it will be in an exam file. And so if we click on the examination data, we find all of the exam files. Now this is, again, just a snip of the top of the list, but you can see here that there's a file, body measures. And if we click on the documentation for body measures, we see a file like this. And every file has documentation like this one. There's extensive documentation. There's really a lot of information in these documentation files. And so if we look at recumbent length over here, you can just click on the variable, and it will give you a frequency table. And you can see the name of the variable, the SAS label, and the fact that this is for males and females birth to 47 months, and that there was a count of 1,470, and the range was 49.1 to 113.9 centimeters. So I recommend for new people, and I did see a lot of names on there that are old hats, but you know the data very well, but for folks that are new, I really recommend matching the counts as the start of a project. Okay. So now I'm going to turn to top 10 analysis tips. I really want to thank David Carranza for putting these tips together. In general, these tips relate to the guidelines, the tutorial, file structure, sample weights, subsamples, combining cycles, changes across cycles, oversampling, data linkage, and then publicly available data. So first, and I mentioned the analytic guidelines before, but we strongly recommend reviewing the analytic guidelines before starting your project. The guidelines contain a lot of information, including on data collection procedures and using sample weights. This first file that you see highlighted in blue provides specific guidance on the pre-pandemic data set. And so really, this should be the first stop when analyzing the pre-pandemic data file. Second, the NHANES tutorials really provide a lot of great guidance on analyzing the data, and we recommend looking at the tutorial before starting to analyze data. The tutorial contains 6 modules, one on data sets, sample design, weighting, variance estimation, reliability of estimates, and a new module that is sample code. And we're really excited about this new module. I'm going to walk you through it. So this module contains a matrix of sample code from 7 NCHS publications on different topics. And you can see the publications there across the top: blood lead and mercury, sugar sweetened beverages, depression, hypertension, osteoporosis, and anthropometry. And code examples are provided in SAS, Sudan, Stata, and R, and you can see they're color coded. So SAS is blue, Sudan is green, Stata is orange, and R is red. And you can see then for downloading and importing data and using correct sample weights, there are examples of code for each of the different publications in those different languages. Now, you don't see, except for the Depression publication, code in each of the different languages yet. We are working on this, and we plan to update update examples so that there are code in all of these languages for these 7 publications. If you scroll down the matrix a little bit further, you see that there are lots of other topics, and this is just the next page. I'm not going to go all the way through the matrix, but we have some descriptive statistics and hypothesis testing and confidence intervals. And these 2 we will be adding information, example code to these different cells. Now you see a bunch of cells where there's no example code. And that's because not every publication has all of these things in them. So for example, if you look at percentiles, only the last publication has code available, example code in Sudan. And that's because that's the only publication that actually has percentiles in it. So the empty cells will not be added to, but the cells that have examples of code, more examples will be added in other languages if all 4 aren't there. So if you get a chance, please explore this. We're really excited about this addition to the tutorial. Okay, back to our top tips. Number 3, keep in mind that your variables of interest may be in different files. And it's important, you will then merge data sets using the respondent sequence number, which is SEQN. And where can you find more information on how to do that? The data analysis tutorials. There's a lot of, there's sample code in there on doing it, as well as explanation about it. So 4th, you want to make sure that you use the appropriate sample weights in order to produce nationally representative estimates. And the screenshot here shows the sample weights from the pre-pandemic data file, but all of the files have sample weights. So in general, if only the household interview data are being analyzed, the interview weight is used. For exam or lab data, or interview and exam and lab data, the exam weight is used. There are other sample weights, including dietary sample weights. And again, the tutorial is a great place to go for more information and examples on using the weights. 5th, some components include only a subsample of respondents. For example, some participants only some participants undergo some environmental exposures or have fasting blood glucose measured. In fact, the fasting blood glucose is measured only on a half sample of respondents who are measured in the morning. And there are specialized weights for these populations as well. And again, the tutorial is a great place to go for more information. 6, when should you combine survey cycles? Well, data are released in 2-year cycles, as I mentioned, and 2-year estimates are nationally representative, but 4 years of data generally provide more reliable estimates. And so if you need help on combining cycles, what should you do? Go to the analysis tutorial. 7th, so it's important to be aware of changes in the components over time across cycles if you're combining data or if you're comparing trends over time, because components may drop in and out of the survey from cycle to cycle, and within a component, questions can be dropped, renamed, or reworded. It's really important to check the documentation, which I showed you an example of earlier for the variables for consistency over the survey cycles. So this screenshot is from the survey content brochure, and it shows the examination components within the MEC that have changed since 1999, at least just the very top of that. It's a very big table. And a link to that is available on the search variables page. 8, so understand the implications of oversampling Mexican Americans and Hispanic persons. Between 1999 and 2006, Mexican American persons only were oversampled. And so that estimates can be generated for Mexican American persons. But after that, starting in 2007 to the present time, all Hispanic persons have been oversampled. And so you can produce estimates for Mexican Americans as well as all Hispanic persons from 2007 on. However, the estimate, you can't really produce estimates for other Hispanic subgroups. Ninth, NHANES data have been linked to several federal administrative databases, including the National Death Index, Medicare and Medicaid data, Social Security Administration data, and housing and urban development data. There are webinars available on the NCHS website to help you work with the linked data. And finally, number 10, not all NHANES data are publicly available. More sensitive data or data that could pose a disclosure risk can be found under the limited access data tab here you see in red. And so this is showing you, if you click on that, for the pre-pandemic data, what you'll find, at least the top 3 files that are in the RDC. And so there's the example of alcohol consumption and STI screenings, which are restricted. So documentation from these files, including the frequency tables, like the one I showed you earlier for recumbent length, are available online, but the data sets cannot be downloaded from the website. In order to get access to the data, you need to use the Research Data Center. And so access is obtained through the Research Data Center after submission and acceptance of a research proposal. And there is a sample proposal online that you can follow. I do want to note, this is this big blue box, that the Hyattsville location isn't open yet, but all 31 census RDCs are. And then I just want to end with a couple of slides on specifically related to analyzing the pre-pandemic files. So I'm going to make 4 comments about this file. First, the data can be used like any other cycle to make national estimates. Second, the 2019 March 2020 data are not nationally representative. And so that period cannot be compared to the 2017-18 data. There were weight adjustments that were done to create this file, and those weight adjustments were designed for overall estimates, not for all the subgroups. So that just keep that in mind when you're looking at trends over time in subgroups. And finally, this data file is a 3.2-year sample. So the variances and standard errors are smaller than the 2-year data, but larger than for the 4-year data sets or for when you combine 2 cycles together. And finally, there are some survey components that began data collection in 2019. And so the only data available are from 2019 through March 2020. They couldn't be combined with the earlier data from 17-18. So these data are available. They're not generalizable to the US population, and they're available only through the RDC. So thank you very much. I think there's some time for a couple of questions before David talks, David's presentation.
Thank you, Cynthia. So we have time for just a few questions. There are a few in the chat. Actually, Cynthia, I think the ones I see so far, I can help with. There was a question regarding why thyroid hormone markers are missing in most of the cycle years. Cynthia mentioned briefly, I think just shortly after you posed the question, that content comes in and out over the cycles, and you'll hear more about that in David's presentation. But it depends on what is proposed over the various cycles, whether it's included or not, and also the determination of the sample size. The question mentioned a lower sample size. That is also made in conjunction with the proposer. David can talk more about that. I think he'll be addressing that in his presentation. There was also a question as to whether the slides would be available, the presentation. The answer is yes. The presentation will be, or is being recorded and will be posted on our website. Another question that came in is regarding the RDC. The Hyattsville RDC is open and we'll be able to.
I don't think no, I don't think it's not open yet. I checked with Neil, but it will be open hopefully soon. Yeah.
Thank you, Cynthia. Let's see. Cynthia, while we're scanning for other ones, let me pose a question for you. Is there a tutorial specifically for dietary data analyses?
Yes, there is, and we are currently updating that tutorial and hope to have that posted sometime in the middle of the year.
And as a follow-up to the existing tutorials, do they have code samples for imputing or handling missing data?
Not for imputation, but I believe there is text about reweighting data when there's missing data.
And another comment and question, thanking you for the presentation and asking, can we combine two data cycles, such as can we combine 2015-16 and 2017 to pre-pandemic? And if so, then which weights will we use?
Yes, you can do that. And there is information on the weighting adjustment that you would do that is available. Yep. And you can email me separately afterwards. You saw my email address. It's cogden@cdc, and I'm happy to get back to you with answers to specific questions.
Thank you, Cynthia. Please continue to send your questions into the chat, but at this time, we're going to pause the question and answer, and I'd like to invite David Woodwell, the Planning Branch Chief, to start his presentation. Thank you.
All righty. Good afternoon, everybody. Can everybody see my screen and hear me okay?
Yes, David, we can.
Yes.
Thank you.
Great. Thank you. All right. Good afternoon, everybody. As Cynthia said, I was going through the participants, and it's great to see so many familiar faces. And I also saw a lot of new people, so that's wonderful as well. I think Lisa introduced me, I'm Dave Woodwell, the Chief of the Planning Branch within the division that conducts HANES. And I am excited to be talking to you about the next iteration of HANES 2024. I hope that what I'm going to present to you today is useful and helpful as we start this proposal process. But certainly if you have any further questions and things aren't answered and we run out of time, possibly, please feel free to email and I will be happy, or my group will be happy to get back to you. Alrighty, so what I will be covering during this segment of the webinar is what we know right now in terms of the 2024 survey design. And that includes the sample, the release of our data, and us becoming a little bit more mobile within our locations. And then I will get into specifics about our content solicitation process that was just put up on our website this morning. So as we begin this exciting process to redesign the National Health and Nutrition Examination Survey, we certainly had planned to be a little bit further along in our planning, and so that I would be able to share a little bit more details with you. But for various reasons and deadlines that we're going to have to meet, we couldn't wait to start the process any longer. But we are very happy to be able to begin, and we hope you are ready. We're ready to take off, and we hope that you are ready to join the survey with us. All righty, so as I'm going to be going over, there will be a lot of changes and differences from prior cycles of the survey, but what will not change is our objective and goals. So our objective of HANES is still to assess the health and nutritional status of adults and children in the United States. Our two goals are listed there as well: to produce the population-based prevalence estimates and trends of those 4 items there, as well as to establish and maintain a biospecimen program. So let's jump right into what we know about the survey design for 2024. At this point, we do not have a final contract award. We were certainly hoping at this point it would have already been awarded. And one of the main reasons some of the details are not quite known at this point, but they are forthcoming and we will be sharing them with you as things get worked out. But what do we know about 2024? And they are listed here. First, each year will be nationally representative. This is for those of you who have been with us in 2019 and 2020, that was an issue, but we're going to be going back to every year being nationally representative. We are going to be oversampling by race and ethnicity again, and possibly by some specific age groups. We will be also going to more locations or primary sampling units than we have traditionally. The numbers are still to be worked out, but we know that we'll be going to more than 15 locations. But we will again be with the overall arching goal to be getting 5,000 people through the examination each year. And that's important. And that's always, yes, that we still will be maintaining that 5,000. So for 2024, we will also be working to release the data a little faster. As Cynthia had mentioned, we would release traditionally data after a 2-year cycle. And our plan is to now try to release data on a more annual basis. And what this is going to result in for some current content is that we're going to be reviewing and rethinking the schedules of various aspects that we do on the backside of the survey, but for reading contracts, lab contracts and such, we're going to be reviewing those and seeing what improvements we can make and working with current collaborators so that we can release the data a little bit more quickly. As everybody knows, that's the big mantra right now is faster, faster, and we need to do that. And there will be some disclosure risk issues that will need to be worked through as well. As I mentioned, in 2024, we also are going to become a little bit more mobile. Currently, as you know, we have our trailers that go into a primary sampling unit or county most of the time, and they are stationary within that area. But what we hope to do is to be more mobile within that primary sampling unit. In the difficult situation that all federal surveys are finding themselves right now, with the declining response rates, this is becoming paramount to be able to get these people and have access to them and to reduce their burden to come out to the surveys. So like I said, once we're in a location, we will move throughout that area so that it's much easier for people to get out to us. But this will also mean that with these more mobile units, we will not enjoy quite as much room, even though room is kind of thought of right now as at a premium, but it will become even more so as we move towards these more mobile units. Everybody will need to be making use of more modern validated equipment that has a smaller footprint within their area so that we're able to potentially have as much content as we can get into the unit. Space will be at a premium in these cases. So, like I said, that's for what we know right now. And I would like to now jump and go into our submission process for 2024. As I said, I saw a lot of familiar names in the participant list, and as HANES has been in the field for 50 years, more than 50 years at this point, I just want to say thank you to all of our collaborators and partners that have made HANES the survey that it is. That's the first thing that we need to do, is to acknowledge all the support that you guys have provided to us from this point forward, and we hope that you are there with us in the future as well as we undertake this new redesign of the survey. So I hope, if you haven't already, that you are able to please read the letter that was posted up on the website, and I'm going to be going through all the steps here. So in a minute, but if you haven't already, to please read the letter that was posted, make note of the deadlines. And like I said, I'll go into specifics here. Always use, as you're reading that letter and you're looking at the deadlines, to please look at the earlier deadline, the earliest deadline, depending on what your submission and what type of data collection is going to involve. So always use the earlier deadline. Questions without sort of a complementary exam or lab portion or content are not encouraged, but that doesn't mean that we are not accepting any. There will certainly be, like, for example, social determinants of health type questions that we know are coming in, that we are working on, that are very important. Those type of things will not necessarily be connected exactly to an exam or lab, but they definitely are something that that we'd be looking at. So that's just an example. So it's not recommended, but certainly we know there are topics out there that are very important. So you will find in the letter a link to open and download this content solicitation form. Previously, if you've been with us before, we referred to this as the letter of intent. We now just have this fillable content solicitation form. I want to make, as we were developing this fillable PDF, unfortunately, what we didn't take into account is when you open it up on our website, the way, at least for I can speak for CDC, it opens it up, it forces the opening up in the browser environment, not in the Adobe software. And some of the functionality that we had built into the form is not there. So we encourage you to open it up and save it, and then complete it on sort of using the Adobe software, and then submitting it. As you see there, the address there, the email that you should use to submit your completed solicitation form is dhanes_PB for planning branch at cdc.gov. And please put the subject line of 2024 Hanes new content. We will acknowledge receipt of your form. So if you submit it and you don't get an email back from us, please reach out and we will review and respond to these forms within 2 months after the deadline. What are the deadlines? The deadlines, and this is all in the letter, for any kind of content that includes examination, and examination is April 15th, a teeny bit off of a month away. Questionnaire content alone or with lab is April 22nd. And then for just laboratory content, June 10th. And you may ask, why have we determined these deadlines? And some of them may be a little sooner than you would like. And it is because we have backed up in all the approvals and processes that we need to go through. If you are proposing an exam content, it might need a pilot or a pre-test. Questionnaire might need cognitive testing. And we have built all of this into our time frame, and these are the dates that we feel we need to ask for your content from now. And again, I'm going to say this many times, there's the email address that we would like you to use to submit your completed form. Okay, so how exactly, if you haven't seen this already, how exactly do you find this letter and the form? So as I think as Cynthia had shown on our main page on the website, this yellow box was updated as of this morning. You can click the orange box there within the larger box for getting over to that letter, or you can also just simply click on the left-hand side, the new content and proposal guidelines, both of which will take you to the same location. And that location is here. So when you click on those links, you will be brought to this letter. Point out two quick things here. There is the link to our website, in case you're looking at this off of our website, as well as in the red box there, what we are looking for in your content submission. And this is also the same way that it will be evaluated once it comes back to NCHS. This is the second half of the letter that I want to sort of highlight. In the red box is the clickable link for the content solicitation form. And I will show that in a minute. Yeah, that's the fillable PDF. The dates, the deadlines are shown there in blue. And of course, once again, the email address we want you to use, please, for submitting it or any questions. So when you click on that link, you will be brought to this fillable PDF. And the pictures that I'm showing you in the slides today here are those from, again, the web, the browser environment, and not the full PDF version, because it does look and act a little bit differently. The areas that we are asking you here, the boxes, the things that we want you to fill in here are pretty self-explanatory. You are able to add more than one name and one email address. We ask you, though, to keep them parallel as much as possible. So the first name would go with the first email address, second name, second email address, of course, so on and so forth. The title of what you're submitting, followed by the age groups that you're targeting. But this is a time that I want to emphasize to you that we understand that, number one, you have just a little less than 4 weeks to submit this, and some things still may not be worked out. We understand this is an iterative process for both you and us. And right now we are asking you to submit the area as you see it going into the survey now. It doesn't mean this is hard and fast. And we understand that in the future, and it certainly has happened before, that some of these may change. But for right now, we're asking you to fill in, obviously, the way you see the content and the age groups that are being targeted now. The second part is, again, it helps us a little bit if you would just please check off the types of content that you are proposing by a description. What will happen here is you fill up that box, the font will just become smaller and smaller to fit everything in it. Have no worries, though, that it will still be there and it's not going to go away. But as briefly as possible, if you could describe the proposed content that you're submitting. Second, I think these are fairly straightforward as well. Public health importance and significance of what you're proposing, please. Followed by, and this is only applicable to exam or laboratory content, any technical requirements that you foresee for that content, including any equipment needs. Again, we're not expecting you, if you do know, great, please put it in. But if you don't know exactly the specific model or what have you for the equipment that you're going to be needing for this submission, that's fine. Just give us what you do know. It gives us a sense as we're moving forward of sort of in our head of what you're thinking and what we need to plan for potentially. The last box there, specifying safety or privacy issues and exclusion criteria. So if you're looking at females of childbirth age, please, you would obviously, and if your content would exclude pregnant females, that we would want to know that up front as well here. And the last part of the letter, so I think near and dear to most everybody's heart here is this checkbox, which is, as Brian had mentioned, unfortunately, NCHS does not support funding of all this content, and that we will need and rely upon you to provide the funding. We are not, this checkbox is just you guys are just acknowledging that you will be expected to pay and to fund what you are proposing. We are not expecting you to have already obtained this funding, but that you know that in the future you will be needing to pay for it. And last but not least, a box, sort of a catch-all, if there's any other information that you feel or comments that need to be put or made for us to know, please put that in that last box. Last, the evaluation. How will all of this be evaluated? After the deadline, only those proposals that are received by the deadlines will be reviewed. And then again, because we have ourselves on a very tight deadline schedule here to get this done, the decision criteria are in the letter and shown here. And this is how we're going to be evaluating it within the division. If we review and we feel like this is something that is going to be feasible and that we're going to be able to include in the 24 survey, where we will invite you to submit a proposal, a full proposal. And this is at the stage, and this is at the point of which we will need you to provide all the details that you know of at that point. And this is definitely where, you know, the devil's in the details type of a thing. And that's, we're going to be looking for as many details as you can possibly put in that proposal. Again, the email address here, that's the same email address that you're going to be using for questions as well. So I will now move to the proposal. If you are invited, you will have approximately 6 to 8 weeks to submit a full proposal. There are specific instructions that will be sent to you on what to include in your proposal. And we're working on those now. Don't worry, we'll send them to you, and we will also post them on our website. This is also at the point where I will be assigning a HANES staff person, a point person for you, and they will be your go-to person for any kind of questions or issues that you're having as we work through getting this into the survey. I do want to make one point just to be totally transparent here, is that although if you make it through the first process of the content solicitation process, the 2-page fillable PDF, and we ask you for a proposal, that does not, if we're asking you for a proposal, it does not necessarily mean you're a definite into the survey. It means it looks good, but we need to see the details, and we need to know what exactly, you know, because that's the point where we really start to refine the content that we're going to be putting in. So we definitely don't take that lightly. We understand you all are putting in a lot of effort and time into this stuff. So certainly we're not just asking for everybody to submit a proposal, but there's still a chance that if we do, we may not be able to accept it in the survey. And once this occurs, once the proposal, we're going to be trying to make a decision within 2 months. So in summary, only the proposed content received by the deadlines will be considered. Always use the earlier deadline of depending on what you're proposing for the content. You will hear back from us within 2 months. If you are invited to submit a proposal, you will have an additional 6 to 8 weeks to get that to us. With our end goal being that we are going to try to wrap this up by the end of the summer, fingers crossed. There's a lot for us to undertake and go through before that time. To say again, it's a very iterative process. I hope you know that we will work with all of you through this. And if you have any questions, any problems, we're going to be making sure that we answer and resolve all the issues that come up. So at that point, Lisa, I think I am done. Thank you very, very much. And I'm going to turn it back over. And if there's time enough, I think, for some questions and answers. Thank you.
Thank you, David. We do have a lot of questions to try to get through. So let's see how many we can get.
Excellent.
One question was, is this solicitation for new content only, or would it also apply to revisions of current content?
Great question. Thank you very much for asking. This does refer to new content. We will undertake, in fact, we've already sort of started the process for current content. And we're going to be reaching out to our current folks individually on current content, where we're going to be asking for some information as well. We are trying to take a holistic view here at this point. So we're going to, for the information that we're going to be asking for, we need to see the bigger picture and how it all fits together. But this right now is just for new content, yes.
Thank you. And following on that, is there a targeted overall exam length for the redesigned survey?
We are going to try to keep it, again, going back to our issues with response rates and burdens to the participants. We are going to be keeping it, we're going to be trying to be keeping it to where we are now, more or less. I don't want to say hard and fast that we have an exact time frame. We are trying to keep it closer to where we are now in the COVID environment, which is 2 hours. As you know, previously to COVID, it was much longer, but we're going to be trying to keep it shorter than longer is what I can say right now for sure.
Thank you. Cynthia, a couple of questions for you related to tutorials. Will there be a ANOVA post hoc analysis method in the tutorials?
I think what we're really trying to do is to use the tutorials to provide code. And so really the module 6 is what we're going to be adding to. And you can see there are a variety of topics that are there, and we will continue to add code examples in different languages, but also topics.
Thank you. And will additional tutorials that were formerly available be updated, such as the logistic regression, et cetera?
So we're really moving towards these code examples, as I just mentioned, so that there are examples of logistic regression from the different publications. And actually, I had an idea I think it's a good idea during this conversation that perhaps we could add the pre-pandemic data document and the analysis from that document as examples of analyzing the pre-pandemic data, and that might be useful to people, so that instead of having 7, have an 8th document. So really that's what we're trying to expand: the documents, the code examples, and the topics.
Thank you. David, back to you. Or actually, Cynthia, no, I think you could take this one as well. Will any data be available for the years and months after March 2020 until the 2024 survey is released?
This is for me. So there was no data collection after March 2020. We are currently in the field, and that cycle will be complete in, actually, David may know, or Lisa more, I think sometime mid 2023, and then those data will be released after that.
That's correct. So right now, the 2022 survey will go into the summer of 2023.
Thank you. Continuing on, we have time for just a few more. With NHANES going into an intended annual release, will there be an annual opportunity to propose new content, or will content only be added at longer intervals?
Yeah, great question. And honestly, I think we're going to be filling this one out as we go along. I do not think we would be able to undertake a process of an annual process to add more data in. I think as we're going to be taking a longer view as well for NHANES and planning content. I know to help the folks and some of our collaborators where they are planning, when they plan their budgets out so far in advance, we're going to be trying to do the same thing where we're planning content a little bit farther out in advance. But I don't know at this point, I don't see us being able to add. We may add content each year, but it won't be a formalized process by which we are asking for new content every year, if that makes sense. It may be more iterative and on a case-by-case basis as things roll in and roll off.
Thank you, David. We're almost out of time. I'm going to address a couple of questions related to funding, and then I'll ask Rennie to close us out. So a question was, do we have guidance on costs for new content, specifically interested in additions to the questionnaire? That's something that you'll work with, when you submit your proposal to the planning branch. They can put you in touch with me or with Brenda that we can do some draft cost estimates for you. There are not set costs associated with every component at this time. So we'll be happy to work with you on that. And then as to which fiscal year should you plan for a funding commitment, fiscal year 23, fiscal year 24, I think that also depends on the complexity of what you're proposing and when we need to start work on it. It may require FY23 funds. We may be able to wait until 24. So just please be in communication with us and we'll be happy to help with those. I know we have a lot more questions that we haven't been able to address. We would encourage you to reach out and please submit those questions that we didn't get to or ones that come up to you after we disconnect today. The address is there on the slide. If you would send it to dhanes_pb@cdc.gov, we'll be able to address things further. And with that, Rennie, if I could invite you to just close out our session today. Thank you.
Thank you, Lisa, Cynthia, and David. For all of our participants, I hope today's webinar has provided something useful to all of you, whether you analyze NHANES data, plan to contribute new or continuing content, or both. I am aware that some of you have already reached out on the 2024 survey and are ready to join us in this next phase of NHANES data collection. I appreciate your continued trust in us and the value you see with NHANES. I hope you will be submitting letters of intent for content by the deadline specified by David, and definitely be a partner on NHANES 2024 and beyond. So with that, thank you all.
Thank you.
Conversation that perhaps we could add the pre-pandemic data document and the analysis from that document as examples of analyzing the pre-pandemic data, and that might be useful to people, so that instead of having 7, have an 8th document. So really that's what we're trying to expand: the documents, the code examples, and the topics.
Thank you. David, back to you. Or actually, Cynthia, no, I think you could take this one as well. Will any data be available for the years and months after March 2020 until the 2024 survey is released?
This is for me. So there was no data collection after March 2020. We are currently in the field, and that cycle will be complete in, actually, David may know, or Lisa more, I think sometime mid 2023, and then those data will be released after that.
That's correct. So right now, the 2022 survey will go into the summer of 2023.
Thank you. Continuing on, we have time for just a few more. With NHANES going into an intended annual release, will there be an annual opportunity to propose new content, or will content only be added at longer intervals?
Yeah, great question. And honestly, I think we're going to be filling this one out as we go along. I do not think we would be able to undertake a process of an annual process to add more data in. I think as we're going to be taking a longer view as well for NHANES and planning content. I know to help the folks and some of our collaborators where they are planning, when they plan their budgets out so far in advance, we're going to be trying to do the same thing where we're planning content a little bit farther out in advance. But I don't know at this point, I don't see us being able to add. We may add content each year, but it won't be a formalized process by which we are asking for new content every year, if that makes sense. It may be more iterative and on a case-by-case basis as things roll in and roll off.
Thank you, David. We're almost out of time. I'm going to address a couple of questions related to funding, and then I'll ask Rennie to close us out. So a question was, do we have guidance on costs for new content, specifically interested in additions to the questionnaire? That's something that you'll work with, when you submit your proposal to the planning branch. They can put you in touch with me or with Brenda that we can do some draft cost estimates for you. There are not set costs associated with every component at this time. So we'll be happy to work with you on that. And then as to which fiscal year should you plan for a funding commitment, fiscal year 23, fiscal year 24, I think that also depends on the complexity of what you're proposing and when we need to start work on it. It may require FY23 funds. We may be able to wait until 24. So just please be in communication with us and we'll be happy to help with those. I know we have a lot more questions that we haven't been able to address. We would encourage you to reach out and please submit those questions that we didn't get to or ones that come up to you after we disconnect today. The address is there on the slide. If you would send it to dhanes_pb@cdc.gov, we'll be able to address things further. And with that, Rennie, if I could invite you to just close out our session today. Thank you.
Thank you, Lisa, Cynthia, and David. For all of our participants, I hope today's webinar has provided something useful to all of you, whether you analyze NHANES data, plan to contribute new or continuing content, or both. I am aware that some of you have already reached out on the 2024 survey and are ready to join us in this next phase of NHANES data collection. I appreciate your continued trust in us and the value you see with NHANES. I hope you will be submitting letters of intent for content by the deadline specified by David, and definitely be a partner on NHANES 2024 and beyond. So with that, thank you all.